Hi, I'm Ashley Cooley, a birth, baby, and sleep specialist and mom of 3. There's so much information out there, right? This show is dedicated to helping you clear out the noise so you can figure out what will work best for your baby and your family. If you're looking to learn more about your baby, gain more confidence in your parenting, and get as much sleep as you can through it all, you've come to the right place. Bringing up baby is about to get a little easier. Hey guys, today we're talking all about your baby's teeth because we don't talk about their teeth much, do we? When do babies typically get teeth? What should we do to protect those teeth? Because yes, even though they will fall out eventually, you still want to make sure you're taking good care of those pearly whites. So to help us navigate the world of baby teeth, I connected with my dentist, Dr. Trish Brady. She also sees our daughters, and we were all in there recently for cleanings and checkups. Even little Miss Mabel, who's just 3.5 years old. But I have a feeling a lot of you will be particularly interested in this episode because Dr. Brady and I are also talking about soothers and thumb sucking. A lot of babies are using one of these to help them sleep or be comforted, and that's totally fine. My own kids did this. But when it comes to their teeth and development of their mouth and jaw, there are some things you'll want to think about, which we're going to get into. So let's do it. Here's my conversation with Dr. Brady. Dr. Brady, thanks for joining me today to talk about little baby teeth. I'm excited.
My pleasure. I'm quite excited to be here. Thanks for the opportunity.
Awesome. So Dr. Brady is actually my dentist and the girls' dentist, working at Spring Garden Dentistry in Halifax. But I'm really glad that we're getting the chance to do this for the podcast in particular, because I find we don't really talk about teeth for the little babies very much. I in particular, in working with people at the prenatal level, with sleep consulting, around feeding. We're talking about all the other things, but teeth send it. I don't know, maybe we just assume because they're going to fall out anyway that we don't have to pay much attention to them, but I think we kind of do. And so that's why you're here. So Dr. Brady, can you start by telling us when parents should expect baby teeth to appear and what they should do, or if there's anything they shouldn't do when that happens?
Yeah, so I mean, there's definitely a range of what is, considered normal for when first teeth will come in. But in general, it's usually around 6 months. Certainly see earlier than that. There is conditions where babies are actually born with a tooth or two.
Have you seen that at all?
I do actually have one patient that did have that. I think I wasn't there. She was just born with a tooth. I don't think I saw her until she was either 6 months or a year, maybe even. But so I didn't see the tooth when she was just born. But it does happen, and I would say there's a lot of dentists that don't see it, but we certainly do know about a neonatal tooth. And then I have seen cases where parents will bring in a child, even beyond 1, and they haven't had a tooth yet. So in the case that I did see of that, eventually they did get their teeth. They were just a little delayed, but in general, most times it's around 6 months of age. So, but it's usually the 2 lower incisor teeth that will be the first to erupt. But again, that can be, variable. If you'll sometimes see another tooth come in first, but usually around 6 months in the lower incisor teeth.
Right. I have 3 kids and they all had teeth at different times. I've had one, she got them right around 6 months. The other was past a year. Maybe you were talking about us. We were the ones that oh, she doesn't have any yet, but here we are. But they came soon after. And then our third was somewhere in the middle. You have 3 kids as well, right? Do you find, all their teeth must have come in differently too?
Yeah. I can't, my kids are 12, 10, and 7 now. So I think that they were ranged from 4 months to maybe 8 months or so. But they were generally all within that, around that 6 month mark. So
there's quite a range, I guess, is what we're saying. A pretty good range of normal here. So I feel like there's been, maybe debate's not the right word, but there's been some change a little bit in the messaging, I think, around, and especially particularly in Nova Scotia, the Dental Association. Maybe you can shed some light on fluoridated toothpaste and whatnot, or maybe that's just around here. I'm just curious. So when the teeth do appear, whether that's 4 months, 6 months, a year, are they meant to brush twice a day with the fluoridated toothpaste or with the non, or is that a choice? Do we
Yeah,
have?
so great question. And this is one that you do sort of have to use your own personal judgment on this. And I do find that there is mixed messaging. Like when I was going through dental school, we were always told, fluoridated toothpaste, great at any age, as long as you're using an appropriate sized amount. And then at some point along the road, the NSDA and the CDA, the Canadian Dental Association, had sort of recommended avoiding fluoridated toothpaste up until age 2. And then actually just recently, when I was making sure I was up to date on everything for this podcast, I was on the American Academy of Pediatric Dentistry website, and they are recommending fluoridated toothpaste right from the get-go when teeth first come in. And you should be using a really small smear, like a grain of rice sized amount, until about 2. And then at age 2, you can up that to a pea sized amount. So
is that really because they're expected? Sorry, is that because they're expected to like be able to spit, I guess, more of it out, so they're ingesting less?
Yeah, I wouldn't even really say at 2 they're really expected to spit. I mean, I would say that's good. Probably a little bit older. Yeah. But you'd really have to be like the amount. First of all, kids' fluoridated toothpaste does have a lower concentration of fluoride compared to adult. Mm-hmm. So whenever your child is able to spit on their own and you're confident that they're not swallowing a lot of it, then it's definitely safe to start using the adult fluoridated toothpaste. But you'd really have to be swallowing like a significant amount of like tubes of toothpaste in order to get any sort of fluorosis or fluoride toxicity. So if you're just using that appropriate either pea-sized or grain of rice-sized amount, depending on their age, then you're going to be getting the benefit out of the fluoride. And the benefit is that it sort of hardens the enamel surface of the tooth, or it makes it more resistant to tooth decay. So that's why dentists are famous for loving fluoride and having fluoridated water and whatnot. So
Right. Okay, awesome. Well, thanks for clarifying that, because it is, I always love to say too, like these are parental choices, but it's important to know the ins and outs, and then you guys can figure out.
Yeah, and if you're choosing to use a non-fluoridated toothpaste, I mean, that's fine. You're still getting the benefit of the mechanical brushing of food and debris and plaque off the teeth. You're just not applying that topical fluoride to the enamel surfaces. And that's the same rationale when you go to the dentist and get your teeth cleaned and they put fluoride on at the end. It's just to, apply. You're not ingesting that fluoride and taking it in. It's more just a topical effect, which is very safe. So
right. But also something they make a choice, right?
Which is absolutely.
Yeah. Yep. Perfect. Awesome. Okay, so when is it that they should see babies go to the dentist? If they're expected around 6 months, like is it timeline from since they first got teeth, or an age thing, or what's happening at that first appointment too?
Yeah. So definitely the latest you'd want to wait is like the first birthday is when we would want to see kids by. And the rationale for that is because most kids will get teeth around 6 months. We want to have them being seen by the dentist within 6 months of the eruption of their first tooth. So, if a tooth comes in at 2 months, then you could, by that guideline, you could see them 6 months later at 8 months. And then we want to, even if you have no teeth at 12 months, it's usually just even good to get them in to assess. And if we need to do a referral anywhere, or just go over, over some things that we want to go over with parents to set up good healthy habits for as their kids are growing. So typically, and I do get sometimes people will ask me, well, what if my dentist won't see kids until age 3? I used to get that a lot more. I found that when we were in dental school, we weren't that see the child by 12 months of age wasn't as much of a thing. It was more like the thought process was, oh, they're not going to be very cooperative until around 3, so might as well delay seeing them until 3. But that's certainly not the case anymore. And if you do have a dentist that, is an office that you go to that they are not willing to see your kids before 3, then I always just say, well, you can just find another dentist. There's lots of dentists that will see kids at 1. So
Awesome.
typically what we'll do in that first visit, there's not a whole lot of, dental care, or we're not going to be doing a cleaning of the teeth at that point. It's more of a parent education session to kind of go over the things like fluoride, oral hygiene, and dietary and snacking habits. And we will also do a quick exam, because there certainly is some kids at anywhere from 6 months to a year or even beyond that will develop early childhood caries or decay or cavities on their teeth. And we want to be able to screen as early as possible for those conditions, so that we can, again, do a referral if need be to the pediatric dentist at the IWK or in the community. And then go over things with the parents to make sure we're setting up for good habits to prevent any further decay or problems.
So this might sound like a silly question, but I know it's been on people's minds. I've had it on my mind at one point too, like, because they are the baby teeth, and because they are, of course they're going to have them for a few years still. So we do want to take care of them for those few years. But does it have anything to do with how the adult teeth might appear later or anything like that? Like the main reasons, I guess, for really taking care of their teeth is just so that they can use them as they get older until those adult teeth come in.
Yeah, absolutely.
Yeah.
So there's a few different reasons why primary teeth are important. Number one is kids are using them to speak and chew and eat, and of course have healthy nutrition. If a child has a large cavity in a primary tooth or an abscess, an infected tooth, then that can cause a significant amount of pain, even if they don't have a big infection like a swollen face, which certainly can happen. That can certainly affect kids wanting to be able to eat. It can affect their sleep at night if they're waking up in pain, that kind of thing. And their just general overall health. So
awesome.
Aside from,
that's not
just
awesome, but
yeah,
sorry. Yeah. Good information. Good. Yeah.
But aside from all of those things, like sometimes I'll have, a child who's does have an abscess tooth and it needs to be removed. And parents will ask me, well, why, they're going to get another tooth. Why does it matter that their baby tooth, they don't have one baby tooth, they've still got lots of other ones, and there's no more infection or pain or anything now that the tooth's gone. But what can happen is that we can get space loss with for adult teeth to erupt. So if you have a primary tooth that's lost early for whatever reason, it's not even necessarily from decay, then
a fall off the jungle gym.
Yeah, trauma.
I know. Yep. It happens. Yeah.
Yep. Then I always let parents know that there's a potential for the baby teeth and then the adult teeth as they're coming in to sort of shift and move around, and can cause, the adult teeth to not erupt in a normal functioning pattern. And then, that means they're going to have, more invasive orthodontics down the road to create space, that kind of thing. So,
right.
So there is things you can do. We can make little spacers for if you lost a baby tooth early. But yeah, all these things are good reasons why to keep your primary teeth as long as you can.
Right. Stay on top of it. Absolutely.
Yeah.
So guys, these podcast episodes are great and all, and I love getting the chance to share some evidence-based, practical, and non-judgmental information to help you along your parenting journey. But now there's a way to get even more. Introducing the Bringing Up Baby membership community, a place where we continue the conversation from these episodes, where you can access incredibly helpful resources like my new baby sleep guide and so many more. And it's also a place where you'll make new connections and can participate in live education sessions every week on a variety of baby-related topics. Yes, lots of them are sleep-related. Trust me, the value of this membership is like no other. To To find out more and to sign up, visit birthbabysleep.ca/bbs-community, but we'll link to that in the show notes. See you there. You mentioned something earlier too that I want to talk a bit more about, because when it comes to seeing the dentist around the first time, maybe it's around a year, and you're saying it's very educational. I remember finding that first appointment very educational. I remember thinking, like, what are we doing at the first appointment exactly?
Yeah.
But it was very helpful, because they are eating typically more solid foods whenever that time comes. Perhaps they're still getting bottles or milk overnight, breast milk, whatever that may be. So what changes in that regard as they get older? Does things change, and what's the education around that piece, if you don't mind sharing?
Yeah. So you're kind of talking about for dietary, where diet comes in as far as it can impact tooth decay and sort of the health of the teeth. So the biggest thing for, kind of toddler age or kids that are on solids and not just nursing or on bottles, is that if you've got kids that are frequent snackers or grazers, that's when we can see more likely chance to develop tooth decay. So cavities are basically caused when everybody has bacteria in their mouth. So it's the acid that's produced by the bacteria that causes tooth decay or a cavity. So in order to get a cavity, you do have to have bacteria present, and you have to have food or substrate for that bacteria to feed on, so that they can thrive. And as they feed on that plaque or food, then it produces the acid, and that's what causes cavities. So of course, most of us know that high sugar foods can cause cavities, but there's also just carbohydrates or starchy foods. So toddlers that often eat a lot of, cracker type things, or, little, things like Cheerios that you don't think of as necessarily unhealthy.
Right. But are so easy for them to eat and very common. Yeah.
So if your child is sort of walking around the house with easy access to, a little bowl of Cheerios or crackers or something throughout the day, then that bacteria is kind of constantly getting a snack to snack on. And then they're producing acid throughout the whole day, as opposed to if they're sitting down and having a meal or a snack, then, they might produce that acid for about 30 minutes and then it goes away. So, so that's why, it's important not to have them either using like a sippy cup with milk or juice or anything with sugar in it throughout the day as well. That can be kind of a high risk for causing tooth decay as well.
Interesting. So how does that apply then if there are still some babies that are, say, being nursed overnight or given bottles through the night? There's sugars, carbohydrates there, right? So
absolutely.
What's the message kind of around that?
Yeah, so that's a great question. And I find a lot of parents aren't aware of the risks of either bottles or breastfeeding throughout the night. So dentists are always big proponents of, nursing and breastfeeding your kid, or bottle feeding, whatever's working for you. And basically the big thing that most people know already is that putting a baby to bed with a bottle is risky for tooth decay. What the rationale for that is that if the baby's having a bottle as they're falling asleep, they're probably not swallowing all of the milk or formula that's in the bottle, and it sort of pools in their mouth and sits on the teeth all night. And of course, milk and formula both have sugars in them, and they can cause that's a snack for that bacteria to feed on all day and all night. Breast milk is a little bit different. So breast milk is not cariogenic. It doesn't cause cavities. But what we can see is when kids are old enough, that 6 months age, when they're starting to go on solids, but they're still probably nursing a bit at night or even during the day, what can happen at night is if the food that they've consumed throughout the day, if it's not 100% removed by brushing before they go to bed, if they're being nursed to fall asleep, or if you're co-sleeping with your baby and they're kind of latching on all night, and then that breast milk is pooling again in in the mouth and there's a little bit of food mixed in it, that's when you kind of see the same effect as putting a baby to bed with a bottle. So the good question is when is it okay to not, or when do we see the problem happen when because it doesn't, lots of people nurse their kids beyond 6 months, into a year and whatnot. We have a general rule of thumb that by about 12 months is when we sort of see that time period happen. If you're nursing in the night kind of constantly, and they're falling asleep on the breast and that milk is pooling beyond 12 months of age, that's sort of a good general rule of thumb of when we can see it. So see the tooth decay happen.
Yeah.
So it's a very complex issue with lots of reasons why the decay might occur.
Yeah.
So that's why there's so many, factors that go into it that you just have to kind of use common sense. And if you're a mom that's nursing your kid through the night beyond 12 months of age and you're going in for a quick feed and they're falling asleep, after they've fed and they're awake, and they've swallowed the milk, you're probably not going to get any issues with early childhood caries. But
I see. So it's that constant pooling of it, which, like, as you said, it's a complex issue from the dentist point of view, as you said. And I think it's a complex issue just in general, because like you said, so many babies still want to, and so many families are still nursing or feeding overnight. And like, we don't consider those things necessarily. So it is good to know. It also is a good enough reason to do some sleep training at a particular point if you need to. Actually, that's going to go in my flyers next time. That helps the teeth too. No, but really not to say that everybody has to do that. They don't, but it's really just great to be aware of that this can happen. So many families do, as we said, as we've been saying, will nurse through the night or provide bottles or do those kinds of things. And there may not be an issue. So it's not like it's going to happen with everybody. How big, do genetics play a big role when it comes to teeth and getting those dental caries? Or do they?
So we definitely do. That's a great question, because I'll get people that say, come in and say, well, I have soft teeth. My mom had soft teeth. It's a genetic thing.
Yeah.
Genetics always play a role, in everything a little bit. But the biggest thing I would say I see is that it depends on the type of bacteria you have in your mouth as well, which tends to kind of be passed down in families. So, of course, when kids are first born, they don't have any bacteria in their mouth yet. And oftentimes the bacteria will be passed on to them from their mom, parents, siblings, hugging, kissing them, whatnot. So if your natural kind of flora in your mouth contains more bacteria that causes cavities, then you're going to be someone who is more likely to get cavities, throughout their life. And of course, oral hygiene and diet plays a role as well. And those habits do kind of get passed down in families as well. So we'll tend to see, as adults, I'll see people that, families that tend to be more likely to get cavities versus some other families that are more likely to get periodontal disease or gum disease issues. So whether or not it's genetics versus the type of bacterial flora in their mouth or their habits, they all kind of play a role. So
interesting. Okay. Very cool. So surround yourself with people that have good flora. Good mouth.
Yes, exactly.
That's dating profile questions. Okay.
Yeah, exactly.
So one last thing I do want to chat about before we go, because it's something that came up in my family twice for two different reasons. And it comes up with a lot of families as well. I know, because lots of babies have soothers, or they might choose to suck their thumb. And I've seen as my kids have grown. So my firstborn, who just turned 9 the other day, which is crazy, but she started with a soother, switched to her thumb when she was around 7-8 months old. And I remember thinking, oh, this is great, because she's always going to have her thumb, and she's sleeping beautifully, and it was wonderful. But then you start thinking, how are we going to take this away at some point? Because it's clearly become a crutch, a comfort, a thing as she does. And I did
Yep.
it too. I understand.
Yep.
But that was definitely a different scenario when we did get rid of that. And that's a whole other podcast episode.
Yeah.
But my middle child was the soother, and she loved that very much. So Stella stopped sucking her thumb, or we were able to help her stop doing that just after age 5. Frankie was just around 2.5 or a little bit over when we got rid of her soother. And she had, well, they both had changes with their mouth. We could tell the jaw, the teeth, the shape of the teeth. Frankie with the open bite because of the soother. It was even off to the side a little bit. We knew exactly where she liked to place it in her mouth. So, and it was incredible how just after maybe 2 weeks or so of them not using those things, that, wow, the change that their mouth went through. But so there's got to be a time though where I feel like there's just stuff to talk about here. So first, I want to talk about this soother thumb sucking stuff. How does it affect their adult teeth coming in? Is that the same for all kids? Like, does it go back just so quickly, no matter when they get rid of it, or
when
if they
stop,
do? Yeah. Just, can you talk a little bit about those?
Yeah. Yep. So definitely thumb habit and soothers can have an effect on the way your teeth and jaws form and develop. So like you mentioned, like the classic open bite, from where your thumb goes in the mouth and kind of pushes the upper teeth up and out. And then the lower teeth get pushed, down and back, kind of thing. And the same thing with the soother. Like, it's almost like there's that little spot where the soother or the thumb went. So if you continued those habits on into when you were finished growing, then it would stay like that. You couldn't, you're finished growing, your jaws and your teeth aren't going to come into a natural position. So at some point we do want to discourage these habits. So soothers are a little easier to get rid of, because you can just take away the soother, or give them to the soother fairy, whatever you tell your child.
Yes, which it was very helpful to do that. I always find you either do it early or and maybe not introduce it, or help them with that earlier if you want, or wait till they're older when they can go to a soother fairy, or we're giving them to the babies and they don't have to know that COVID's, you know what I mean? But that talking to them helps.
And the thumb is, of course, harder to get rid of. So
oh my gosh,
you might have to wait a little bit longer until your child's old enough to understand and why they need to stop sucking their thumb. So if you go on to the Academy, American Academy of Pediatric Dentistry, they do recommend getting rid of a soother or thumb habit by age 3. Now, I mean, I don't know how that's going to go over with a 3-year-old, trying to explain to them why they need to stop sucking their thumb. I think it's a little bit early, on the early side, if you've got a thumb habit. But if your child is continuing to suck their thumb beyond around age 5, then there is concern that the teeth and the jaws aren't going to kind of go back to where they should be. And some people do have naturally just have an open bite the way they're developed, even regardless if they have a thumb habit or not. So some of it can be just the way the jaws are coming together. But certainly you do see, if a kid has a thumb habit beyond, into their, 8, 9, 10, then they're probably going to need some form of orthodontics to correct their malocclusion or their issue with their bite.
Okay.
So the Academy of American Academy of Pediatric Dentists says, as long as the earlier you can get rid of it, the better, when they don't need it to soothe themselves to sleep anymore, which is kind of around age 3. But beyond up to age 5 is kind of when you have that window before it's going to kind of naturally close back on its own once they get rid of the habit. So,
yeah. I remember taking, like, we had a dentist appointment with you right around that time when she was turning 5, and the conversation that you were able to have with her and she was able to have with you, and understand, like, because we had been talking to her about it beforehand. At the time we brought it up to you, you were able to talk to her about it, and that really stuck with her, that conversation. So it was like I remember seeing you on a Monday, and that
Yeah.
Friday we like took that week to build off of that appointment.
Yeah.
And that Friday was when we started the process of helping her sleep without it. And because that's hard, that's where they pop it in and they're not even aware, they're half asleep.
I know.
So
And we
like
do
I said,
have like,
no,
we
go
have
ahead.
sometimes have like tools that you can, I tell parents sometimes, well, you could try to put like a mitten on their hand or a glove, something that stays on.
And that's what we
overnight, so that
did.
if they did, you guys do that? Yeah,
that's what we did. I mean, it helped. It was winter, it was colder, and but that is what we did, and we did that for a good long while. But that, like I said, that's literally going to have to be, well, I have a blog post about it actually, because a lot of people have asked, because I mean, it is hard to think about how to help them get rid of the thumb. But anyway, this has been really helpful, this whole conversation. Like I said, Mabel and I will be showing up at your office this week, and Mabel, where she's 3.5, like she's turning 4 this summer, and she hasn't been in to see you yet, and a large part of that was COVID related. So we're looking forward to this appointment. Luckily, she's got lots of space in her mouth.
That's good.
Not all of my kids have
spaces.
So anyway, that'll be interesting. Stay tuned for that. But thank you so much, Dr. Brady, for joining us. It's been a really helpful conversation, and you cleared up a lot of questions, I think, for all of us. So thanks.
Great. No, I was happy to do it anytime.
Looking for more? Check out birthbabysleep.ca, where you'll find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. You'll also find me on Facebook and Instagram at Birth Baby Sleep. It would be awesome if you followed us wherever you listen to podcasts, and if you can, leave a review or a rating, which goes a long way for helping others to find us. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.